Okay, so a little bit more on yin and yang. What does that mean? It's kind of like a vague concept. So as I was explaining before, yang is more substance. Sorry, it's more energy. So sun, light, active, so that like chutzpah. Whereas yin is more of a substance, and it's feminine, it's moon energy, it's darker, it's more concentrating. So just an example of what yin excess may look like in a person. So this could be someone who's sedentary, has a poor diet, and as a result has heaviness and congestion in their body. So that's substance, that's weighing them down. So they have too much of this substance that's really holding them down, and primarily in the lower part of the body, just based on their symptoms. This in turn creates poor circulation with the blood, and then the yang, the duality, is not able to process or penetrate and move things. And as a result, you get an imbalance, and then you get further symptoms that come from this. So yin excess can show up in the kidney. So we have low back pain, varicose veins, achiness in the lower body, painful menstruation in women, and overall just feeling out of balance. So everything goes back to that. So what happens when there's too much yang? So it seems like, okay, you can't have too much yang. Like, too much yin is terrible. But no, you really want to be in the middle. So what happens when you have too much yang? It's someone who's really exercising too much, and you don't have that yin to really anchor them down. So what's happening? Their reserves are gone. They're experiencing draining, tiredness, low libido, poor appetite, lower than normal hormones. So their hormones may be super low because they just don't have enough of it, because the yang is acting too heavily on those yin substances. Can lead to amenorrhea or different ovulation problems. So just an example of what some patterns may look like, but these patterns are specific to the individual. And that's kind of the beautiful part of Chinese medicine. Starts off really simple. Is it a substance? Is it an energy? Where are we at? And then from there it just branches out into thousands of diagnoses. And everyone is different. And you show up different every week, which is also amazing. You progress, you regress. That's why it's important to look at vitals and make sure everyone is doing okay week to week.